In the case of a cholera outbreak that has been reported in 12 counties, hunger pangs are still sending Kenyans to uncertified eateries. It is booming business in several eateries within the Nairobi Central Business District, despite the national and county governments warning that bordered on declaring cholera an epidemic. But questions on how food is handled and the source of water in these joints remains a big challenge in the fight against cholera.
Even if somebody has a certificate, everybody in the hospital has, in the hotel has a certificate, but the water they are using is not clean, you'll come evaluate.
Dr. John Kiru, a researcher at the Kenya Medical Research Institute, says the ongoing water shortage affecting parts of the country has largely contributed to the outbreak of cholera.
So the key to breaking this outbreak is solving the water problem. Then the sewage. I think many of us know, not only in Nairobi, in many places, especially in town areas, you see sewage spilling all over. That needs to be solved. Sewage management, garbage management, water management.
Kenyans being advised to treat their water for domestic use.
The water problem will not be solved tomorrow because it might not be possible. What we need to do, whenever you are buying your water, make sure that the water you are using is not simply boiling, because you cannot boil a whole 100-liter jelly can. But what you can do, you make sure you chlorinate the water, and you can use the additives, you can use the AquaGuard, and it's very simple.
In order to contain the situation, the Ministry of Health ordered for the cancellation of all medical certificates for food handlers, as well as a directive to close the Jacaranda and San Valencia hotels until their staff are certified to be free of cholera. This, even as experts question the closure of some hotels, saying the move might not help much.
We should be able to come back and be able to do proper lab tests, such that people do not only have a certificate, but this certificate is properly investigated on a lab bench. Because this is very important. We are not only thinking about cholera, but we have amoeba, we have typhoid, and so on.
Although cholera can be life-threatening, it is easily prevented and treated, with doctors advising the use of vaccines before infection.
Vaccine is only a long-term solution, because it has to take time to protect you. And remember, most of the cholera vaccines, they are not lifelong. So when you go and get that vaccine, you have to ask your doctor for how long will the vaccine last. Sometimes 6 months, sometimes 1 year, depending on the manufacturer.
And with cholera symptoms easily confused with those of food poisoning and amoeba, the most distinct remains passage of watery stool containing rice-like particles.
The reason why the cholera diarrhea is watery and it has some whitish substance like rice is because your stomach lining and your intestinal lining has peeled off. So it is the peels that look whitish. At that position, even if I gave you antibiotics to take through the mouth, they will not help you.